Hello, my name is Dr. Roosevelt Daniel, and I'm the Co-Chief Medical Officer at North Central Family Medical Center in Rock Hill, South Carolina. I'm a practicing physician in both internal medicine and pediatrics, and I've come to you today to talk to you about the flu vaccine. Influenza is a viral infection that typically involves the respiratory system. It can cause cough, can cause fever, body aches, runny nose as well. And annually, thousands of people are infected with, get hospitalized, or can even die from the influenza infection. So influenza as a respiratory infection can be prevented, or the incidence of infection can be reduced by people maintaining a safe social distance, by frequent hand washing, making sure that if you cough, you're coughing into the pit of your arm as opposed to on your hand to try to prevent the spread of infected particles between people. Now, another very effective way to prevent influenza infection is to also receive vaccination for influenza. The influenza vaccination has been available for at least more than 50 years in our country. We have a very long track record of safety with influenza vaccinations. So the flu vaccine every year contains 4 different viruses, 2 influenza A viruses and 2 influenza B viruses that were common in the season prior. Our flu vaccination for this year, again, will comprise 4 viruses from the previous flu season, which usually lasts from late September until early April. So there will be 4 viruses in each of the influenza vaccines. Now, these viruses are not complete viruses. They are what we call inactivated viruses, where part of the virus has been removed so that you don't actually get the full influenza infection by being vaccinated. The flu vaccine is currently recommended for anyone 6 months of age or older to try to prevent serious infection, in particular in the very young and in the very old. Also, anyone that has any cardiovascular or respiratory illnesses as part of their chronic health, they should also take the flu vaccine because they're at increased risk for dying and hospitalization from influenza. Typically, the flu season will begin in late September, early October. So the best time to get your flu vaccine is in September. The flu season usually lasts until March. The flu vaccination initially takes 2 weeks to kind of give you immunity, which is why we recommend you get it in September. And protection from the influenza vaccination usually lasts about 8 months. Typically, as with most vaccinations where we give part of the infectious agent of the virus that actually causes the infection, people can have mild symptoms as their immune system starts to build up antibodies to protect them from the actual virus. Those side effects typically will include soreness at the injection site. Some people may even have mild fever and mild body aches. Most people do not have any respiratory symptoms as a side effect from the vaccination. But again, fever, soreness at the injection site, and sometimes mild body aches as well. So when people receive a vaccination for influenza, they are receiving an inactivated version of the virus. This inactivated virus doesn't cause an actual influenza infection, but it does alert your immune system to make antibodies against the virus, so that if you come in contact with the virus in the environment or outside of a vaccination, that the length and severity of your illness will be greatly reduced. And this has been proven time and time again as we've had this flu vaccine for at least 40 to 50 years. And consistently, we show that people who have had the vaccination, if they do get the influenza virus, then they don't have as long or as severe an infection of the flu.